We got to sit down with Dr. Copeland from the Atlantic Reproductive Medicine Specialist Fertility Clinic. It's located in Raleigh, North Carolina. And in this brief podcast, Dr. Copeland talks about the various ways and approaches to getting pregnant. With the internet full of so many different ideas and myths about getting pregnant and whether or not you can determine the gender of your baby, we set out to address some of those myths and talk about the very basics and beginning journey of a couple or an individual looking to build their family and conceive. Dr. Copeland, thank you so much for being with us today. Please give us an overview and an idea of the journey, the beginning journey of what couples should experience and expect when trying to get pregnant today.
Well, I do think that, there are three tiers of things that we talk about when we sit down with patients for preconception counseling. And the first tier, the foundation, the base that I want all of my patients to think about is their own health and wellness. Because then if they are taking care of their body as well as they can, on top of that, we can layer fertility treatment. But if they're not taking care of their health and wellness, then there is evidence to show that fertility treatment doesn't work as well. For example, when we look at pregnancy rates with our most invasive type of fertility assistance, when we look at IVF, we can see that those folks who are of normal body weight have higher pregnancy rates than those folks who are overweight and obese. So I like to talk to my patients about the same things that a general provider, a primary care provider will talk to them about with regards to measures that will keep them dancing when they're 100, longevity. The things that are good for our physical being are likely good for our fertility being. So I talk to them about sleeping, getting more than 7 hours a night of sleep, eating well, real foods, limiting processed foods. They may be convenient, but there's a lot of extra stuff in there with regards to sugars and salts and preservatives that may not be good for our overall goals as far as body weight that does impact on fertility, limiting known reproductive toxins, cigarette smoking, cannabis smoking, high intake of alcohol. All of these things have been shown to have effects on eggs and sperm, so trying to bring those things down. And movement. Women who have irregular menstrual cycles, when they do studies on lifestyle habits of women with irregular menstrual cycles who are in trials to help them ovulate better, it is the people who are moving, who are walking, who actually have higher fertility rates. So I don't prescribe one type of exercise. That's a very individual type of thing for most people, but I do tell them to get moving. And that will be helpful not only for their fertility now, but for their future longevity. And supplements are also something that we talk about. In the perfect world, we would all, eat the perfect diet, but I don't know anybody who lives in the perfect world. So, taking a prenatal vitamin for women, taking a men's wellness vitamin for men can help some of the things that we may just be missing in our daily diet. If folks are not consumers of omega-3 fatty acids in the form of fish oil or flaxseed, you can do an omega-3 fatty acid supplement, and that's good for wellness as well as some data suggesting that it improves semen parameters. Antioxidants such as vitamin C and coenzyme CQ10 have some evidence that those are beneficial for both sperm and egg. So really the things that we do to help folks take care of their own well-being will also help take care of their fertility well-being.
Absolutely. A healthy lifestyle and fertility are obviously connected in many ways. One of the challenges that couples face today when looking to conceive and begin to build their families is the various myths and information available on the web. Prior to reaching out to a fertility specialist, couples are likely going to be searching online for answers and insights into the best way to conceive. how would you address this issue, and what are some of the recommendations you would make in terms of food or sexual positions that a couple might try?
When my patients bring those references to me, I like to go to kind of the peer-reviewed literature, what's been studied, and try to find any scientific basis for what they're reading. To date, there has not been a trial that has been structured in a way to prove that something that we eat or position that we try will affect the gender of the baby. As a practical matter, millions of sperm are ejaculated, and it is the sperm that dictate the gender. And just knowing how reproduction happens makes it unlikely that being in any one particular position would be beneficial, because the sperm are going to, once they're into the vagina, they are going to get into the cervical mucus and up into the fallopian tube and penetrate the egg. And when the sperm get to the egg, there are many sperm that are trying to get through the cells around the egg, and there's actually a shell around our female. It's not like a chicken shell, but it's like a sugar coat shell around our eggs through which the sperm need to penetrate. And we don't have any evidence to suggest that we can affect gender through things we eat or positions that we try, though I know there are a lot of things out there that propone that. When folks are trying to change or trying to influence the gender of their child conceived, there were two main methods that would work, but they require pretty high intensity fertility treatment. Once upon a time, I don't think it's commercially available anymore, there was a way of sorting the sperm. Essentially, a couple would tell Microsort, the company that did this, what gender they did not want, and then that markers to that gender sperm would be made, and then the sperm would be run through essentially a sorting, and if they were marked because they were the gender of sperm that we did not want, they would be shot off into not being used, and anything that was unmarked sperm was assumed to be the gender that they wanted. It wasn't perfect. I mean, it increased the likelihood of the gender that they did want from a 50-50 shot to a maybe 80-20 arrangement. But that technology was better than nothing for family balancing, but not good enough. And so now the way that folks will know the gender of their child before conception is if they're doing genetic testing of their embryos. Once the sperm and egg become an embryo and that embryo becomes a blastocyst, we can take a few cells out of the preplacenta to look at its genetics. And we do this for medical reasons, folks who carry cystic fibrosis, or they're trying to prevent a disease that their child could have, or if they're trying to decrease the chance of Down syndrome or miscarriage by only selecting embryos that have the right number of chromosomes. A part of that testing does tell you the gender of the embryo, and so if people